Well, away from that story, Hydrocarbon Pollution Remediation Project has launched a major public health study in Ogoniland, partnering with World Health Organization's International Agency for Research on Cancer to conduct a human biomonitoring study. The study aims to examine the link between hydrocarbon pollution and disease patterns in the region, in line with recommendations from the United Nations Environment Programme's report on Ogoniland. Speaking at the inception meeting in Port Harcourt, HYPREP project coordinator Professor Zabe said the launch of the Ogoni Public Health Study marks a key milestone in the concurrent implementation of UNEP's core recommendations.
Most importantly, community involvement is the cornerstone of our work here in HYPREP. Therefore, we expect that community leaders, civil society groups, and health institutions will be brought into this process from the onset to ensure trust, ownership, and relevance are sustained. Furthermore, we will prioritize data protection, ethical research practices, and efficient use of resources to deliver impactful results within stated timelines.
Professor Zabe said the choice of IARC WHO was deliberate, given the agency's global reputation and scientific credibility, which will ensure that the study's findings are both actionable and internationally recognized. He noted that the study will drive policy decisions, guide public health planning, and support long-term monitoring of Ogoni's well-being. Dr. Joachim Schulz, leading the IARC WHO team, assured that the agency will deliver a world-class study while supporting the training and development of Nigerian scientists in epidemiology and related fields.
We know that there's a lot of environmental contaminants that have extremely high levels. And of course, when these chemicals and substances are in the environment, there's a very high chance that people take it up through the inhalation, through the ingestion. That can be drinking water, that can be your vegetables that you're growing in these areas, and that they are accumulating in your body. So the mission of this project sounds in fact very simple. What we want to see, how much of these exposures are accumulating in the residents of the affected areas, and do we measure any early signs of.
Other members of the IARC team, Dr. Ann Olson and Mike Cohen, echoed their commitment to executing the landmark project in Ogoniland.
So we will spend a few days here to meet the people, but we will also visit the fields to see what the facilities are to store the samples and to transport the samples. And we hope to find solutions to all the technical challenges that arise in such a project.
The study will span 3 years and will complement HYPREP's other public health efforts, including the construction of the 100-bed Ogoni Specialist Hospital, the 40-bed Buan Cottage Hospital, upgrades to health centers in Bori, Terabo, Piti, and Nchia, as well as ongoing medical outreach programs.